Hey, good morning, everybody. Good morning, good morning. It's Jillian, and I wanted to do this video today, and I wasn't even planning on this video. I wasn't even thinking I was going to do a video this morning because I'm thinking like, oh my gosh, I did so much. But I know when some of you guys introduce this info to new people, how do you explain this protocol? And there's so much information, and people are under the impression that pain is bad and that disease is bad and everything is bad and it has to be rectified through medicine or holistic remedies. And so how do you take friends and family from 0 to 60 in like 5 minutes without having to go through 1,000 videos? Okay. And so here's a good way to explain it. And I might even like add more to this. So I have this diagram that I made, okay? And so I'm probably going to add more to the diagram to bring in everybody's experiences and what they do, because we already know what people do when they encounter pain or cancer or disease or chronic illness. They apply certain types of therapies, okay? So there's ways of which I'm going to draw this out to then further explain that what you do in the therapy world is a direct correlation to the weaknesses that you had from the initial trauma. Okay, so I was trying to figure out how to explain to some of John Oak's friends, because I mentioned symptoms, and you have 11 different systems that can have so many different symptoms and diseases. So I'm going to explain those diseases so that way you understand where I'm coming from, that all of the symptoms and the diseases are actually like a red flag, and it's not bad. It's like your insurance policy. It lets you know that there is a weakness, there is an imbalance, and you have to go and correct it. And if you don't, you will forever be continuously applying protocols that are obviously not aligned. And then this is when people start seeing the systematic degradation of their body. So to make this really, really easy and short for some people, so at least for Kevin, for those of you that have been kind of following me for a while, post-traumatic stress disorder or PTSD or any kind of major trauma or minor trauma. And this doesn't even have to happen during your lifetime. This could have happened in the womb, I guess, or your parents having trauma and weaknesses that you've inherited, your grandparents, the parents, like great-grandparents, great-great-great-grandparents. I mean, you've inherited so many different traumas that you don't even know that you have weaknesses in some of your systems. So you could be looking at your whole medical history, which people do because they want to figure out what they are predisposed to, what weaknesses they hold, and then they can kind of figure out, map out their medical plan, which is what they do when you go to a doctor. They ask you your medical history. But some people don't even know their medical history. Like me, I don't know my medical history because I'm adopted. So everything that I find out is just like, it's a surprise to me. So I'm glad that I don't have a lot of huge issues, but I had the PMDD, which who knows when I acquired that. And it could have been from certain procedures and stuff that I did during my lifetime. So, but yeah, so all the PTSD in all of your 11 different systems, and some systems had more trauma than other systems, which is why you see then different types of therapies, different types of medication, different types of disease names, okay? So PTSD plus then the therapies you apply to it. So you think about all the drug therapy, you think about all the talk therapy, you think about all of the massage therapy and the physical therapy and the immunotherapy and the chemotherapy and the holistic remedy therapy, the hot yoga therapy, the sauna therapy. I mean, you think of every single therapy you can think of, it's the wrong chemistry to apply to a body. Okay. So then what happens is then you see that, I remember diagramming sentences when I was a kid back in like 3rd grade. Okay. So then you see then the trauma. So you already sustained trauma from the PTSD, which is kind of redundant, but it makes you kind of see. Then you apply, then you get trauma from all the therapy. So the drug therapy with all the side effects, When you go to the doctors, you apply therapy, and then you deal with the weaknesses from that therapy. So it's trauma to the body. Okay, when you go and work out and you go and run and you go and change your diet to, like, you know, keto diet, to the paleo diet, to the vegan vegetarian diet, to the fasting, to whatever it is that is totally like trendy on the market, that's a trauma to the body, because you're not applying the right chemistry. You're just trying to change your biochemistry superficially, and in turn it causes another trauma. And in turn, from those traumas become weaknesses, because weakness, you know, you can have a weakness, but it doesn't necessarily have to be a disease. Okay, so you may have a weakness. Let's say someone yelled at you, and that's a trauma. Let's say somebody said that you were mean or bad or this or that. That's still a trauma, and it's kind of overlooked as it's like it's not going to turn into some kind of crazy disease or cancer. But then you accumulate all these different traumas over a course of a lifetime. Little things turn into big things. And this is where then all the weaknesses that you've accumulated over however many years that you've been around then turn into a disease. But what are the weaknesses? There are imbalances in your fatty acid, because whenever you sustain a trauma, it then brings up hormones. And then you already sustain weaknesses from other issues, other traumas. And so then you have these diseases that are a conglomeration of different systems of your 11 different systems. So then you have disease names that encapsulate like 5 or 6 systems at once. You know, the cardiovascular system, the digestive system, the endocrine system, the skeletal system, the respiratory system. And now you have some exotic disease that nobody knows about. Okay. Yes, Nico. Thank you. Nico Gleach. Exactly. You are causing chemical imbalances over time. And so then you have imbalances in your fatty acid, amino acids, your prohormones, and your minerals. And then when you apply more therapies, which are the holistic, allopathic, you know, talk therapy, all these different therapies on a body that's already weak with trauma, you are now essentially reinfecting yourself, and you're not getting the real true healing. You're just getting what you call state of execution. You're mitigating pain because you think that's healing. And then you start seeing yourself degrade even faster. And which is why people end up in the hospital and in hospice, because they allow their body to get that bad. Okay. So, so this is kind of like a really quick way of looking at how PTSD plus all the therapies then trigger trauma, then trigger weaknesses, imbalances, and then this is how you then get to the disease. Okay, so I'm telling you, every single holistic practice, so if you go see a naturopathic, a homeopathic, you go see an MLMer with all of their protocols, you go to a doctor, you go to a therapist in any way, shape, or form, you go get, you know, what is it, energy therapy, spiritual therapy, whatever it is. When you see somebody because you have a weakness and you're getting their knowledge, you're paying them money, even if they give it to you for free, and they're saying, oh yeah, you touch yourself here, you touch yourself there, you can bring up a hormone here, you can bring a hormone up there, oh here, take a crystal and do this and hypnotize yourself, you are creating essentially more traumas. So that's why you never see anyone truly heal in the allopathic, holistic, homeopathic, naturopathic industry. They're all the same thing, okay? The homeopaths, the naturopaths, the holistic industry is no different than the allopathic industry. It's just packaged differently with a different marketing background. That's it, okay? So what are these diseases and weaknesses? Well, here's the thing. Since people don't understand that symptoms are the diseases, I then now go through a little bit of rudimentary stuff that has to be explained, okay? So symptoms and weaknesses and disease, okay, here are the names, because you have 11 different systems. You have the circulatory system, the urinary tract system, the endocrine system, the digestive system, the male-female reproductive system. You have the nervous system, skeletal, respiratory, integumentary, lymphatic, and muscular. And any disease attached to that is a weakness. It's from a trauma that you sustained either in your lifetime or you've inherited from your predecessors. So you don't even know what kind of traumas you have until you keep applying the wrong therapies to your body. And when you apply the wrong therapies to your body, like taking drugs or doing like hot yoga and whatever, then you affect other systems in your body that potentially could have weaknesses. And then essentially you have then a chain reaction of more weaknesses because you applied the wrong chemistry. And so you could have potentially healed from that weakness from your predecessors, but then every single time you apply the wrong therapy, you're thinking that if you apply a drug for your neuropathy, that it's only going to deal with your neuropathy. No, that's why they have a list of side effects to let you know what other systems are going to be affected. And then what essentially could have been like a benign weakness that could have been taken care of over time now has a trauma attached to it because of that drug that you took. So when you take like a drug for your thyroid because you're missing your thyroid and you have already a sustained weakness in your eyes, maybe potentially you could have fix that weakness, or who knows, maybe your LASIK surgery kind of helped you out a little bit, but now you're seeing that the side effects saying that glaucoma is possible, which means that when you take this drug, it's not only going to then give you the needed balance of your hormones, right, because it's for missing thyroid, but now you're going to be affecting your eyesight. And that's when you see the progressive degradation of the glaucoma, okay? So yeah, so then anyway, so I want to let you know, so PTSD to your 11 different systems that happened in the past, as well as in your predecessors, your predisposition based on what you've inherited, plus then all the wrong therapies, or all the therapies. There's no wrong therapy, they're all wrong. All therapies are wrong, okay? Plus then, and then what happens is it turns into a trauma, then that trauma plus those things turn into a weakness, and then it turns into a disease, because sometimes there's no going back for some of you because you won't be able to handle the healing process when you get to a certain point. Okay, so then there's 11 different systems of diseases or symptoms. So symptoms and disease is the body letting you know, it's your insurance policy letting you know that you need to do something quickly because you are on your reserve tank and you're basically about to deplete your reserve tank. Okay, so when you get diagnosed, you're basically right there on your last legs. So the circulatory system diseases, so you know, these are your insurance policy. Every single disease is an insurance policy, okay? And so the circulatory system diseases are atherosclerosis, hardening of the arteries. So there's imbalances, okay? So these diseases and weaknesses and traumas then cause imbalances in your fatty acid, amino acid, prohormones, and minerals. So the atherosclerosis is a hardening of the arteries. It is typically caused by a diet high in fat. No, it means that you have imbalances in your fatty acids you're not releasing. And so when you eat food that you normally eat, it's just accumulating, and then you have the hardening of the arteries, okay? I mean, that's how you have to look at diseases. Every single disease is based upon an imbalance and either a suppression or an expression of certain hormones that will then trigger disease or trigger healing, because chili juice will trigger the healing. It'll suppress the wrong hormones that you don't want on a life trajectory and express the right ones, okay? And right now, people who are with cancer disease and chronic illness are expressing the death trajectory hormones, the adrenaline, the depression, the oxytocin. They're always looking for tail or something to go and procreate with, because it's like a release for them because they're in so much pain. And also too, the body senses on a death trajectory and it wants to go and mitigate extinction. And so that's why you see the porn industry is so huge, because so many people are on a death trajectory and they're turning to other ways, other outlets, okay? So heart attack is a circulatory a disease that is your insurance policy. And if you survive a heart attack, it means you have enough minerals to give you another day, but you may not be so lucky the next time. So that lady on Dr. Phil who said that she got a stroke from jelly juice, no, she's already predisposed to that. That's already in her family history, in her history, and the body's trying to heal. She was already set to have that stroke because it's already been happening in her world. Or it's a weakness that the body senses. If she never had it, let's say she never had it, but she already had weaknesses in her heart. I don't know her family history. Then the body's trying to heal, and it was taking minerals from different places as well as minerals from the J juice and trying to repair the damage. And the fact that she lived to go on Dr. Phil and slam me is a testament to the protocol, because she obviously was able to live another day. The protocol could have potentially given her the minerals that she was missing. Right. I'm not saying it's wrong, but it's all about life trajectory or death trajectory. The wrong hormones coming to surface, if you're on a life trajectory, is the stuff that is like oxytocin and adrenaline and, epinephrine, which is adrenaline. So when I say right or wrong, it's based upon life or death. People say they want to live. So why are you bringing up oxytocin and adrenaline all the time? Why are you highly charged, depressed, or looking for sex 24/7, or adrenalized, and whatever hormones that come up on a death trajectory? Okay, that's what I mean by right or wrong. Thank you, Kevin, for clarifying, because it's based upon what your perception of where you want to go. If you say you want to live, but you're always bringing up the sex hormones all the time, you're always bringing up the adrenaline, always bringing up the you're always having like depression, but you're bringing up these hormones, then it's the wrong hormone if it's something that is opposite of what your intention is. So the right hormones is the pain hormone. If you want to live and you say you want to live, then you got to bring up the pain hormone, which is the prostaglandin hormone. Okay. And that's what I mean by right or wrong, because you have to understand it really comes from the outcome, the intention and the outcome. If your intention is to live, then all the hormones that you guys are bringing up right now on a death trajectory and then suppressing the pain hormone, the prostaglandin hormone, yeah, it's based upon right or wrong. It has to come from that direction. But if you want to die, then it doesn't matter. You can suppress the prostaglandin hormone, suppress the pain hormone, and bring up your adrenaline and bring up all your oxytocin and all of that, and that's fine. And you just will have a very predictable outcome, which is then the death process. So right hormones and wrong hormones are based upon life and death. If you say you want to live, then you have to express the right hormones. If you say you want to die, then you'll be suppressing the right hormones. Okay? So anyways, but the specific person, the wrong hormone is based upon their intention. See, that's where it comes down to. So you'll glean this out, Kevin. When you're setting people up for what right or wrong is, it's based upon life or death, what your belief system is. If you say you want to live, then you have to express the right hormones that put you on a life trajectory. If you say you don't really care, you don't want to live indefinitely, you don't believe in that, then it doesn't matter what hormone you bring up. You'll bring up whatever hormone is working for you that makes you feel good at the time, because you're living life by moment by moment by moment. But if you are trying to be proactive in life, then there are right and wrong hormones. And that's what I mean by that, okay? All right. Because there is a right or wrong, because there's absolutes when it comes to life and death. There is an absolute of life. Those are the two absolutes in life and death. And there are hormones that get expressed that are based upon those two absolutes. Okay, so hopefully that makes sense to you, Kevin. So that way you get where I'm coming from. Because it's, yeah, I mean, if the wrong hormone being brought up, and if I'm on a life trajectory, is like all these hormone, all these like I don't know, adrenaline all the time, then I know there's something wrong, and I'm doing something wrong in my life. Okay, and it means that there's a certain biochemistry that's going on that I'm not taking control over. So that's what I mean by that. All right. So hopefully that makes sense to you, Kevin. All right. So then the circulatory system is mitral valve prolapse, mitral valve regurgitation, mitral stenosis, angina. So these are all the circulatory system symptoms that's letting you know that, okay, something is going on, and that you need to get those balances. The wrong hormone is being expressed, and the right hormones are being suppressed, and now you're seeing imbalances. Okay? All right. Arrhythmia and dysrhythmia, cardiac ischemia, high cholesterol, heart failure. So all these different strokes, that's when you have imbalances in your fatty acids, amino acids, prohormones, and minerals. And then it causes weaknesses in the body. Then if you have malabsorption from malnutrition, or malnutrition from malabsorption, then the body is then going to steal resources from different parts of the body, or it's going to take the resources and the reserves from the jelly juice and try to repair the weaknesses in your heart. So no matter what, the body is going to try to repair any weakness, any trauma that you've sustained. Okay? So all of these symptoms is your insurance policy. And if you survive your symptoms, you have enough minerals and nutrients to survive another day. But relative to what chemistry you're bringing into your body. So if you're bringing in therapy and you have a history of strokes and heart issues and all that stuff, and you're bringing in therapy, you might not live to see another day. If you're doing the J juice and you get all these different symptoms because that's already in your DNA, your genetics and all that stuff, and you're trying to heal, then you are giving yourself what the body needs, and it needs to heal. It didn't cause all of your issues. You are now finally healing with the right chemistry. Because the body is going to try to heal no matter what. It's going to go through symptoms no matter what. Every single symptom in the J-juice world and in the allopathic holistic world is the body trying to heal. And either you're giving it what it needs or you're not giving it what it needs. But no matter what, the body is trying to heal. And so what it comes down to then is the right chemistry or the wrong chemistry based upon your expectation, your intentions, and then what you expect as a specific measurable result. And if you don't believe in living indefinitely, then no matter what you do, it's not going to matter. But if you think that living indefinitely is a possibility, this is when you have to understand right or wrong. Okay? And then that way you understand the indicators of what is fluctuating during the healing process. You know you're going to have to deal with, you know, fluctuations in your biochemistry. You're going to have to deal with pain. You're going to have to deal with all the different, you know, thoughts and feelings and things as the body regulates. Because you're going to be releasing hormones that are going to make you feel like, you know, like amped up or totally depressed or who knows what. And you have to understand it's all normal. And you got to keep doing the J juice because eventually your hormones are going to regulate, and then the right hormones will be expressed and the wrong hormones will be suppressed. And then you can understand that since you're doing the J juice and you're on a life trajectory, if you see something go out of whack, which you won't because you'll be doing the J juice, you're not going to allow those hormones to be coming up to surface, but at least now you know the indicators of where imbalances come from. And so that's what right or wrong means. Okay. All right. Okay. So that's the circulatory system. Then you have the urinary tract system. Now I want to go through these because just so you kind of understand what the different insurance policies that are out there, because every single disease is an insurance policy, every single one. So kidneys and the urinary system disease that let you know that there's weaknesses from trauma from past, present, and future. And that is letting you know that you need to apply the right chemistry. If not, then you will continuously have these issues until you pass away. And then you'll see your body progressively in a progressive decline. So bladder cancer, urinary incontinence, bladder disease, urinary tract infections, interstitial cystitis, chronic kidney disease, ostomy, kidney cysts, interstitial cystitis, diabetes insipidus, diabetic kidney problems. Okay, these are all your insurance policies. Okay, diabetic kidney problems, dialysis. Okay, urine and urination, dysuria, kidney failure, granulomatosis and urinal. Okay, hematuria, hemodialysis, hypernephroma or kidney cancer, ostomy or ileostomy, incontinence, infections in the bladder, urinary tract infections. Okay, so you see the kidney disease, kidney failure, kidney stones, kidney transplantation, all that stuff. Okay, tumors, Wilms tumors, nephrolithiasis, nephroblastoma, neurogenic bladder, ostomy, overactive bladder, painful bladder syndrome, urination, proteinuria, renal cancer, renal dialysis, renal disease, renal failure, renal transplantation, stoma, stress incontinence, ureteral cancer, ureteral disorders. I mean, if you go look up all of the different diseases and symptoms of urinary tract, or the urinary tract, I can't remember if you can see that, then you will see that you have, that's your insurance. Okay. So then you have the endocrine system. Okay. And that is huge because that has to do with a lot of your hormones. All right. So then you have like Addison's disease. These are all the endocrine disorders. Okay. And these are your insurance policies yet again. Adrenal cancer, adrenal disorder. So this is adrenaline, right? When you have the wrong hormones being put up during like all the time, because you're going to need, here's the thing, guys. Kevin's right about right or wrong based upon the person, the imbalances. When you are constantly adrenalized and you're constantly like, or you're just lacking adrenaline, you're lacking the fight or flight syndrome, is when there's an imbalance going on. Okay, because there's some people that lack the adrenaline, lack the fight or flight, and they don't see danger for what it is. And so they'll walk into situations that they have no business walking into because they have a hormonal imbalance. Okay. And so it's like, because yeah, you can have too much or too little. And how do you even know what too much or too little is? Because you're so used to operating the way you operate. Well, you know, and some people don't even know. And how do you explain to them? Well, you know, you shouldn't have, when people go after dark and they go feed the homeless after dark in New York City. Okay, who in their right mind would do that, knowing, and if you're a woman too, a woman that's unarmed. And so an unarmed woman going into New York City after dark into Harlem, feeding the homeless, you're missing some kind of fight or flight hormone. You're missing you have a lot of imbalances. And so, but that person wouldn't see anything wrong with that. So they would never think they have an imbalance. They're like, oh no, I'm fine. I go in there all the time. They all love me. And I'm like, and so they wouldn't think it's right or wrong. But to you, but then yeah, it's based upon, you know, like, well, I wouldn't put myself in that position to be kidnapped, stabbed, or whatever could happen after dark in Harlem or in any of these really, you know, just really economically depressed areas after dark feeding the homeless. Okay. So if you're aware of hormonal imbalances, then you can say right or wrong. If you're not aware, then you really can't, you can't really gauge what's safe. And then you see then the imbalances after the fact when you are stabbed or in the hospital because somebody stabbed you. And now you're like, okay, well, I'm not going to go there after dark. The body's now trying to tell you, don't go to New York City after dark feeding the homeless unarmed by yourself. Okay. So sometimes you have to go through some of these traumas so your body and you learn not to practice certain things. Okay. So it's like imbalances are not always something people are aware of because that's how they operate. And you're right, Kevin. You need a small dose of adrenaline for doing basic things like going up and down the stairs, or otherwise you're black out. You're absolutely right. You know, so there's too much or too little. And then there's a certain amount that people can deal with. And then when you see certain career fields people go into, like I was in the sales field, and I still am in some way, but I've always highly adrenalized. I had imbalances in my adrenaline. I was always running my adrenals. And then you see, you know, I'm taking like 6 shots of espresso in my 20s and 30s. And then I'm always doing traveling and meeting different people and going and doing different experiences. And yes, some were kind of dangerous, I'm sure. But my adrenaline and all of my other hormones kicked in and got me out of situations that I potentially could have been like deadly to some people. So I've been pretty lucky, knock on wood, okay? But I don't have those imbalances anymore. I don't take those unnecessary risks like I used to in my 20s and 30s. So when you have too much adrenaline or testosterone, because when you see boys and men take unnecessary risks because they have all this adrenaline and testosterone, you know there's imbalances. And so that's why sometimes men don't grow up until they're after 40, because now they're not taking the unnecessary risk, because now they're seeing the repercussions and they're actually having forethought. Their hormones have finally calmed down a little bit, but they still have, you know, they still get triggered. Don't get me wrong. It's not like they're healed because they got older. No, the body is breaking down, and now the adrenaline is kind of petering out. There's still enough to keep them going, but they're seeing themselves slow down. So with the J juice is when you will see the balance of your hormones come up when it's necessary, then be suppressed when it's not necessary. And it's just that whole up and down type of thing. Okay, but it's not like it'd be up and down like bipolar. It's just the fact that you'll call the hormones when it needs to. When I'm going up and down the stairs, like Kevin said, I need adrenaline to do that. Any kind of movement, you need kind of adrenaline, energy, all that stuff, food. Okay. So, so yeah. So that's the endocrine, diabetes. Okay. So thyroid cancer, oh yeah, here. Endocrine is pituitary tumors, polycystic ovary syndrome, prediabetes. I mean, reproduction, osteoporosis, obesity. I mean, the endocrine system with the hormones, it basically encapsulates almost, it's like everything is connected. Because a lot of they're all connected. Nothing is not connected. That's the thing people don't understand. When you take a drug for something, or you do a therapy for something, they think that, oh, it's only dealing with that specific system and symptom. But then you see in the endocrine system, it connects with other systems. So you're taking a diabetic drug, okay, for diabetes, it's going to affect all the 10 other systems in the body. But people don't think things that way. They just think, oh yeah, I'm taking a drug, taking a holistic remedy, doing a therapy, and it's only going to deal with that system. But no, it's a domino effect, a chain reaction, because everything is connected, okay? And so you see silent thyroiditis, thyroid cancer, thyroid disease, thyroid nodules, someone missing their thyroids, okay? So yeah, so that's the endocrine system. So those are so all these cancers in the different systems and all the diseases in the different systems is your insurance policy. So when you get a vaccine and you already have weaknesses in your body, because a vaccine only holds a virus that you're already exposed to anyways, it has minerals in it and some other bacteria to trigger adrenaline to bring up more antibodies. No big deal. But if you have any kind of adverse reaction, you already had the weaknesses in your body. Okay. It's just now you're going to see how you would actually, what you would probably die from if you encountered that virus in your natural environment from a body that's really, really, really pathogenic. Because there are people who hold some of these viruses that never got the vaccine that would probably kill some of you who already have issues. But the fact that we do have vaccines, it is an attenuated virus, so it's not the strong virus that's out there. So they do the vaccine to say, okay, we already know the virus is coming into our atmosphere. We're going to weaken that version. And that way, even though, yeah, you're going to already get it if you get it from the person who brought it into the environment, causing people to get vaccines, at least it won't be that strong. And so, yeah, it is herd immunity. Herd immunity does exist because it's just about being exposed to a virus. And if you have a strong body, you'll be pretty much asymptomatic. But a weak body with already said weaknesses, no matter what, you're going to have some kind of reaction. And if you have a really, really weak body and you don't get the vaccine, people could die from preventable diseases. Okay? So this is really legitimizes the vaccine industry. That's why I don't allow anybody anti-vax on my page anymore. I already been down that road. I can prove that I still was able to argue for anti-vax, but I have since learned a lot more, and you will see now that I don't hold the same thought process and belief systems like I used to. Okay, soy isn't bad. Vaccines are necessary for those that have already weaknesses. If we had a strong population, we wouldn't need vaccines, holistic remedies, or biotech. Okay. All right. So then there is the digestive diseases. So these are your insurance policies that you know that you are applying the wrong therapies. You had trauma to your digestive system in some way, and you applied the wrong therapies, the wrong chemistry to your body. And this is when you see then this whole thing where PTSD plus then all the therapies equals trauma, which then translates into weaknesses, then turn into disease. And the weaknesses are imbalances in your fatty acid, amino acids, prohormones, and minerals. So digestive disease topics like abdominal adhesions, acid reflux, anatomic problems with the lower GI tract, appendicitis, Barrett's esophagus, bowel control problems, fecal incontinence, celiac disease. See, people think that the wheat is like causing celiac disease, like all the glyphosate and all the GMO. No, you have weaknesses because you had trauma down there. And there are certain foods that will trigger the symptoms, letting you know that you still need that food. You still need wheat. but you have weaknesses. It wasn't the wheat that caused your celiac. You already sustained that weakness, and the body's letting you know you're applying the wrong chemistries with all the different therapies, and even playing the avoidance game. Oh, I'm gonna stay away from wheat. I'm gonna stay away from I'm gonna be gluten-free. Sorry, but now you're applying more of a nutrient that your body already has imbalances in, and then you cause more imbalances because you're playing the discrimination game. And then you're bringing in more of something that your body doesn't need either, because you already have imbalances in all 4 of those components that make up the body: the minerals, the prohormones, the amino acids, and the fatty acids. Okay. So colon polyps, constipation, Crohn's disease, cyclic vomiting syndrome, diarrhea, diverticulosis, and diverticulitis, dumping syndrome, never heard of that, food poisoning, gallstone, gas, gastritis, gastroparesis, GI bleeding, hemorrhoids, indigestion. I had a lot of hemorrhoids ever since I was young, and then they came up during my healing process doing the J juice. So I had to deal with hemorrhoids along with doing the waterfalls. That wasn't fun. And then, being constipated in the beginning because I wasn't taking enough of the juice in the beginning. Oh, believe me, I went through some hell during the first beginning of the process, trying to give you guys an idea of what to expect. Indigestion, inguinal hernia, intestinal pseudo-obstruction, IBS, lactose intolerance. See, people who hate milk, they're like, oh, you don't need milk. Yeah, you do need milk. It has necessary hormones, and it has the nutrients, the macro micronutrients, it has the acids and all of that the body needs. But if you are lactose intolerant, you have weaknesses in your digestive system. You have imbalances in your acids. Okay. Oh, that's what lactose intolerance is you have digestive system acids, imbalances in your acids. Liver disease, Menetrier disease, microscopic colitis, ostomy, surgery of the bowel, pancreatitis. And this is where pancreatic cancer comes from when you have issues in your digestive system. Proctitis, short bowel system syndrome, smoking in the digestive system. Okay, ulcerative colitis, viral gastroenteritis, Whipple disease, your digestive. Okay, and then Zollinger-Ellison syndrome. Okay, so those are your insurance policies. Yet again, letting you know you have trauma. You're applying the wrong therapies, you have a weakness, and now it's turning into a disease. It's no different than, I don't know, when your reserve tank light comes on, your gas light comes on, you have 60 miles or 60 years to correct it, okay? I'm assuming with the reserve tank, you have at least 50 or 60 miles. All right. The next is the reproductive system diseases, another insurance policy to let you know there's something going on, something wrong, okay? And this is like Wikipedia. So, I mean, here's the thing. With the reproductive system diseases, they're going to mention certain things that are very highly politicized. I'm getting all this info from Wikipedia, just so you know, okay? People are going to argue and say, oh, no, this is what you're supposed to be. I have no idea. When I tell people ask me, like, what is J juice going to change my sexual orientation? I have no idea. I have no idea what normal is. We have been doing this thing of man, woman, and whatever for so many years, and we are seeing there are changes going on. I have no idea what's right or wrong, what's normal, what's not normal. Do the J juice, and then you tell me how you feel, how you look, what kind of physical characteristics are now being suppressed and coming to surface. Okay, you let us know. Because if living indefinitely is what you're looking to do, your body is going to act accordingly based upon our evolution. And we could be going into the next phase of evolution. So I have no idea what normal is. Okay. So, anyways, I'm not trying to edit this. So anyways, so don't hold this stuff against me. This is just what is shown here in the Wikipedia. So the different reproductive system infections, the fallopian tube, ovary and uterus infections, vulva infections, penis infections, testicular urethra and vas deferens infections, okay, STDs, iatrogenic infections, endogenous infections, AIDS and herpes, the Kallmann syndrome, androgen insensity syndrome, a genetic disorder causes people who are genetically male to develop sexually as a female due to inability to utilize androgen. Okay, see, this is the thing where I don't know what's normal, what's not normal, but this is the perception of Wikipedia. But they call it, but this is also what's in the DSM, or it's in the books of different diagnoses. Then there's intersexuality, okay? So prostate cancer, breast cancer, ovarian cancer, penile cancer, uterine cancer, testicular cancer, cervical cancer. So these are all your insurance policies, you guys, okay? Impotence, hypogonadism, ectopic pregnancy, hypoactive sexual desire disorder, so a low level of sexual desire and interest. And here's the thing. On either end of the spectrum, when you're really, really healthy or you're really, 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 really sick based upon what's going on down there, yeah, you're going to experience certain things that people think is wrong. So when you are on the J juice and you're not wanting to go and chase tail, somebody will say that's a disorder because it comes from the perception of society that everyone should be sexual forever and should be highly sexual at some point, but not too much, but not too little. Okay, so anyway, so you're also getting the perspective of the medical industry based upon what they deem as normal. Okay, female sexual arousal disorder, conditions of decreased or insufficient absent lubrication in females during sexual activity. Okay, premature ejaculation, dysmenorrhea, and then also the endocrine system is also affected. Okay, so those are the indicators, your insurance policy to let you know something is off somewhere. You need to apply the right chemistry. If not, you're applying all the different therapies and all the different things, the holistic remedies and all the different therapies. Then you're going to then increase the trauma, which will then turn into different diseases. Okay. Then you have the nervous system diseases. And there's another insurance policy to let you know that there's something going on and you need to apply the right chemistry. But why we have diseases is because we already have PTSD from who knows where, from predisposition or something that happened during your lifetime, plus then all the wrong therapies. And then those equal trauma, and then turns into weakness and imbalances in all of the fatty acids, amino acids, prohormones, and minerals. And then it turns into an actual disease, a diagnosable disease. Okay. And so this is where disease comes from. It's from trauma, from therapies, turned into weaknesses, turns into a diagnosable disease, where then you have to be aggressive with trauma, with therapies, which will then turn into more major traumas. And that's why people turn into hospice at some point. Why you see aging in people who are on chemotherapy, and why you see issues people who are on pot, cannabis. Okay. So nervous system diseases, Alzheimer's, Bell's palsy, cerebral palsy, epilepsy, multiple sclerosis, neurofibromatosis, Parkinson's disease. Okay, so this is the nervous system, sciatica, shingles. Wow, I don't know shingles. Yeah, shingles, neuromuscular disorders. Okay, so all of these different disease of the nervous system is based upon imbalance from trauma to the nervous system in some way. The wrong therapy is applied to it, or because the trauma could even be from therapy for another disease. So let's say you go get a disease. Let's say you get a disease or a cancer that you're taking a drug for, and the side effects of the drug has to do with the nervous system. So they say that potentially the side effects is going to be, I don't know, shingles or something. Okay, then you sustained a trauma through a therapy that wasn't even for that specific issue. It was for something else, but everything is connected. So that's why people are a mess, because they don't remember all the things that they've ever dealt with, and there's some predisposition. But then also too, all the therapies you applied caused more trauma to different systems that you had no idea were being affected. But you look at the side effects of every single drug, and then you also look at when you're exposed to viruses, because viruses that are so prevalent out there, you can't get away from viruses. They either will strengthen strong bodies or destroy weak bodies. And all these different viruses then also represent different systems. Okay. And so when you already have a weakness, in some of your systems, and you encounter that virus, it's then going to cause a symptom, okay? And then that symptom turned into a weakness, right? It's a disease. And then you apply a therapy. And now you have what would be on the insert as a side effect of a specific vaccine for that virus. So you see how that works? Hey, John. So see how that works? Is that you don't only get diseases from the vaccines, because the vaccines is your environment. It's the virus that's already in your environment, and it's the minerals that are already in your environment. You will encounter that virus at some point in your life. And if you already sustain weaknesses, no matter what, you're going to get some kind of disease. So when you look at the vaccine inserts, that tells you what you're going to potentially get if you encounter that virus in your environment. And some people will die from that virus. Other people will get those types of then diseases, the named diseases. So this really tells you how everything is connected. Everything is connected. Okay, that's the nervous system. Then you have the bone disorder diseases. This is when people are getting demineralized because of the biochemical triage, where the body, when you have malabsorption, you have malnutrition due to malabsorption, and you have diseases. The bones, the minerals in the bones and the hair, skin, and nails, the integumentary system and all that, the resources will be stolen from them to then keep your vital organs going. And that's why you see progressive aging, okay? So bone diseases, osteogenesis imperfecta. So you have osteogenesis, which happens with bone formation when you regrow bones or when a baby is developing. But then you have the osteogenesis imperfecta, where bone growth is happening where it shouldn't be happening because there is imbalance. There is a weakness, a trauma in the skeletal system, okay? So rickets, fractures, osteomyelitis, osteosarcoma, that's like cancer in the bone, hip dysplasia. So with dogs, like my dog, she had, where's she right here? She has in her genetic makeup, because pit bulls and German shepherds and large dogs have hip dysplasia in their genetic makeup, and that's an inherited disease that was never corrected. And so that's why they say that some dogs have hip dysplasia, other dogs don't. And so when Sugar went through her healing symptoms, when I put her on, when she was on the protocol, she couldn't walk for a week. Okay, so we proactively brought up and healed the weakness that was in her genetic makeup. She couldn't walk for a week. You can ask Jason that I had to sleep downstairs a few times because she couldn't walk up the stairs for a week. She couldn't even get down the steps to go to the restroom. Well, so I had to go take her out the front where it's easier for the steps for her to go down. Okay, but that was only a week that she went through her healing symptoms of hip dysplasia. So yeah, I mean, with the healing process with the J juice, you're going to be revisiting weaknesses that either you don't remember or you do remember. And then from also the side effects from all the therapies that you've ever applied to those weaknesses at some point that you weren't even aware that was damaging your other organs. Okay. All right. So that's a hip dysplasia, bone disease, metabolic bone disease. These are all insurance policies. Osteoporosis, achondroplasia, neurofibromatosis, Paget disease of the bone, osteomalacia, Ewing tumor of the bone, avascular necrosis, marble bone disease, hip fractures, stress fractures, osteochondroma, bone cancer, osteochondrosis, fibrous dysplasia, cleidocranial dysostosis, osteoma, osteoclastoma, bone cyst. What are you doing, Sugar? You can callus. Oh, interesting. Calluses. Wow. Caffey syndrome, mandibulofacial dysostosis. Okay. Okay, so these are all insurance policies. All of these bone diseases is your insurance policy to give you time to go and correct the issue. Modern medicine and vaccines and biotech have given humanity major insurance. But some people don't know how to utilize their insurance, and then they accept their condition instead of trying to correct it, because since they don't know how to correct it, they accept it, and this is what gets mainstreamed in our society. And then when someone says, hey, maybe there's something wrong here, and they're like, oh no, this normal, it's what God gave me, it's what's normal. And I'm like, okay, if you accept it and you don't see any more possibility than what you already have, then that's your right. But if someone doesn't accept their condition as something that they should live with for the rest of their life, give them that opportunity to explore something else if they can. Some people don't have the conceptual knowledge, the intellect, to be able to then change their biochemistry, to then change that condition. Okay, and you just have to accept that too. I mean, I have. All right, and then they have the, there's like 11 different systems, like 8, 9, and 10, 11. So like 4 more, or 3 more, 4 more. There's a respiratory disease, system diseases. And again, these are all insurance policies that let you know that you have weaknesses. You'll see what the triggers, what people say, like, oh yeah, it's the bacteria, it's the virus, it's the glyphosate, you know, it's like all these chemicals. But no, you're always going to be exposed to bacteria. You're always going to be exposed to elements and minerals. And so how is your body going to be able to recycle the environment, to be able to expel the excess bacteria, excess data in the virus, the excess minerals, okay, and the excess nutrients too? And then what will your body absorb to then keep the balance? Because you should be able to recycle your environment on a continuous basis without having overaccumulation or underaccumulation. Okay, so the respiratory system diseases, tuberculosis, influenza. So you're seeing that happen during the different change in seasons, the influenza virus. Okay, chronic obstructive pulmonary disease, asthma, influenza pandemic. Okay, they had that back then. Sleep apnea, mesothelioma, pneumothorax, high sugar, pleural effusion or pleurisy, or yeah, swine flu, asbestosis, pneumoconiosis, atelectasis, oh geez, SARS disease, bronchiectasis, pulmonary fibrosis, bird flu, respiratory disease, MERS, adenovirus infection. That also contributes to obesity. It turns off, yeah, some hormones. So that way, or yeah, there's like leptins. When you suppress leptins, it makes you hungry. When you express leptins, it doesn't make you hungry, type of thing. Okay, Margaret Chan, influenza pandemic 2009. Okay, and then there's lung congestions, emphysema, pneumonia, common cold, lung cancer, bronchitis, pleurisy. Okay, so these are all the insurance policies that you need to understand and figure out, because that'll turn into a major disease, and then cancer. Okay, so we got that. The skin is the integumentary skin diseases, hair, skin, and nails. Okay, so these are all symptoms. So psoriasis, vitiligo, these are imbalances in your integumentary system. It has to do with melanin, melanoma, warts, otitis media, erysipelas, guinea worm disease, boils, skin cancer, purpura, contact dermatitis, nevus, sunburn, skin disease, Ehlers-Danlos syndrome, scabies. These are about mites and all that stuff, hives, acne, dermatitis, necrotizing fasciitis, sclerodoma, hypertrichosis, baldness, impetigo, dermatomyositis, erythema, hyperhidrosis, chilblain, labyrinthitis. Okay, so these are all imbalances in your integumentary system, imbalances in your fatty acids, amino acids, prohormones, and minerals. And so the body is now trying to self-regulate and trying to balance out, but then it also spreads when you have a major taking over of a cancer, of a virus information. It causes more imbalances. Okay, so there's that. And then, so there's that. And then the lymphatic system, and then the muscular system. So the lymphatic system, your insurance policy to then correct the issues is, and this is from Wikipedia, but there is, the Hodgkin's disease and Hodgkin's lymphoma, non-Hodgkin's lymphoma, lymphadenitis, lymphangitis, lymphedema, lymphocytitis. Okay, so there's a lot of lymphatic system diseases. And when people are applying therapies like they're rubbing their lymph nodes and they're not doing the JJs, but they're getting massages, they're touching their own lymph nodes and trying to release stuff. They're doing Reiki therapy, all these different therapies that people are being manipulated with in different parts of their body. You're releasing something that has been sequestered for a reason. But when you have too much stuff accumulate in your lymphatic system and you have stagnation, okay, and you're constipated in your lymphatic system, it does turn into cancer because it takes over. There is an imbalance in the fatty acids, amino acids, prohormones, and minerals, and then the body starts glitching, and then it turns into lymphoma. So yeah, when you have a mineral imbalance and you have all these toxins, these imbalances, these excess nutrients and excess acids and prohormones and minerals, okay, and then you go spray your yard with Roundup. Roundup didn't cause your issues. You already have the imbalance. You already have the overaccumulation of minerals. And then now you're around more minerals and the body is at overcapacity. And then it triggers an upset of homeostasis, of which then the jury who doesn't know any better will award somebody $80 million and blame Monsanto, which I think is a bunch of bullshit, but that's our society today. And so now Monsanto and all these different products have to take into account or put warning labels and say, hey, this is going to cause cancer in some people. Well, how the hell you're not drinking this? But if you already have imbalances and you're around a high amount of minerals that are in the air, then yeah. But it really is the individual's fault. It's not the biotech's fault. It's not Monsanto Roundup's fault. So yeah. So anyways, but that's the state of our world to begin with. So yeah, so Monsanto or any of these pesticide companies need to put on there in some people, not everybody, because I've been around Roundup. Stop it, sugar. I've been around Roundup. I've been around pesticides. I've been around air fresheners. I don't love smelling a whole bunch of air freshener, but my body can handle it. But will I sit in a closed environment just breathing in air freshener? No, because my body knows what my capacity is. And then I need to open up a window to just allow the fresh air come in because I can't handle too much of that air freshener because it's too many minerals. And so you will draw your boundaries. That's what I'm saying. People who don't know their boundaries will overstep, or they will allow people to cross their boundaries. And that's no different than the body's all messed up and they're taking in all these different minerals, or they are avoiding foods and minerals because of some kind of like adverse reaction. But that's also wrong too, because then you're depriving your body of needed nutrients and you haven't fixed the weaknesses. So then that's when you have like the whole fasting starvation. Okay. And so the next thing is the muscular system, your insurance policy. My dog hates it when I talk. So she wants to like interrupt me. It's okay, sugar. All right. So muscle disease, human muscle system, connective tissue disease, myotonia, muscular dystrophy, atrial fibrillation, myopathy, cramp, muscular tumors, polymyalgia rheumatica. So you know, I mean, and there's a lot of diseases out there that are a conglomeration of the 11 different systems. You could have all 11 different systems be involved with one disease. Okay? Sugar, it's okay, sugar. And so this just kind of scratches the surface on these are your insurance policies. Every single symptom is the body trying to repair itself. Okay? And then it goes into then a comfortable homeostasis. So when somebody accepts their neuropathy, but they do take a drug, let's say they take cannabis for neuropathy, yeah, it will suppress the prostaglandin hormone, which is the hormone that will give you the sensation of pain, but it will also help you heal. So when they're taking a drug like cannabis to deal with their neuropathy, they are trying to get into a comfortable homeostasis, and they're comfortable being zombied out, completely anesthetized, until the body goes into the next phase of a more severe disease. So the neuropathy is probably a stepping stone to the next severe disease. And so every single one of these diseases, some are very benign, like a cold flu, like a cold, okay, which then could turn into then cancer 5 or 6 or 10 years down the road based upon the biochemistry and your beliefs and your lifestyle. Okay, so every single diagnosable symptom. And now here's the thing. Now you're dealing with also with mucus, and I experience mucus when I go to the restroom. So when I blow my nose and when I poop, early in the morning when I'm like in bed, like let's say I go to the restroom around like 3 o'clock in the morning, and then I go to the restroom and poop around 3 o'clock in the afternoon. Well, I go to the restroom at 3 o'clock in the morning, and then I poop around maybe 4:30, 5:30 in the morning, and I poop also at 3 o'clock. So I'm actually taking notes on when I poop and when I pee. And then the mucus comes out when I poop, not like out of my butt, but yeah, it comes out. But I mean, I blow my nose, and then sometimes I'll experience a little bit of like blowing my nose in the middle of the night, and then sometime during the day after I eat some food, because the body is expelling any excess bacteria, any excess minerals, any excess acid. Okay, when you have a whole lot of mucus, you need to let that run its course, but it lets you know, it's an indicator that there's a lot that you are in overcapacity and the body's trying to release. And so when you're taking Mucinex and you're trying to stop the healing, stopping the symptoms with drugs and therapies, then you are further weakening the body, not allowing the body to expel what it needs. But the mucus is an indicator that the body's trying to adapt to a new condition. So when you go outside and it's cold outside and your nose runs, it lets you know that, yes, you're now entering into a new environment. You're going through an adaptation process, and your body needs to expel any excess, whatever's in the air. Okay? And so no different than when you eat a food. If you get a lot of mucus or you're peeing a lot, that means that food is a bit more mineralized than your body can handle. And so maybe stay away from that food. I mean, you can handle it in a little bit. Like I had about half of that hamburger helper. That, I mean, if I took a little bit of the hamburger helper, I wouldn't be peeing like every 2 or 4 hours. But so yeah, so it's not like you avoid it altogether, especially if it's FDA approved, but you don't take as much of it. So there's no food that anyone should avoid. Everything, when the body's balanced out, is in moderation. But the reason why people are projecting their weaknesses by putting out like, oh, stay away from Teflon, stay away from, you know, they're afraid of I don't know. They're afraid of all these different like detergents, and they're afraid of the skin condition, you know, the skin. Bless you, sugar. They're afraid of the skin creams and the shampoos and the, you know, GMO and 5G and all this stuff. Every single fear out there where somebody's imposing and legislating morals is somebody has a weakness. Okay, and they're projecting that weakness as if everybody else has the same weakness and they should stop it. They, oh, stay away from Teflon. Stay away from the microwave. I use microwave now every so often. I use the oven a lot more, but I use a microwave every so often. I don't have Teflon anymore because I got rid of it a long time ago. But whatever. But I'm not afraid of using Teflon. I eat processed foods. I eat GMO. Okay. There is nothing that's off the table. I'll eat meat. I'll eat milk. I'll eat soy sauce. Okay. So there is nothing off the table if it's FDA approved or it's a fruit or vegetable. Obviously, I'm not going to drink Drano. I'm not going to be eating Dawn soap because it's not FDA approved. It's not a food. But anything that's deemed safe by the FDA and safe by the EPA, I'm going to be fine with, because I already have a very well-balanced system. So that's how you guys can know who has imbalances, when they're telling you to stay away from all these different things. And they're like, oh God, use colloidal silver. Don't use this antibiotic. You know, the reason why you use antibiotics, the reason why you use colloidal silver is because you have an imbalance. Okay, you can use the J juice for all topical. You don't have to use antibiotics. But here's the thing. You can use any antibiotic you want to. But then you don't realize what other damage you're doing to the body. If I ever get a cut or a scrape, superficial one that doesn't require surgery or being stapled, then I'll use my juice topically. And if I have any kind of issues, whatever, I'll use my juice internally. Okay? If I have a major accident, like if I'm in a major accident for whatever reason, and they put me in, triage, whatever they got to do to get me patched up, fine. And then I'll go home and drink my juice and go through the pain is healing process. So I'll allow the medical system to patch me together with whatever methods they have. I don't care what it is. Okay? So triage, emergency, is probably the best way to utilize the system. Triage is the best way. Emergency room is the best way to just get yourself at a stable condition, and then you go home and drink the juice and you repair from that PTSD. Because any accident, car accident, whatever accident, train accident, tree accident, PTSD is going to happen. But then with the J juice, you're going to repair the damage as if it never happened before. Okay? But why people are progressively declining even after PTSD with the therapies is because they're applying the wrong chemistry. So if you are taking something that has therapeutic effects, then you know it's wrong. Anything that's deemed therapeutic is the wrong chemistry. Yeah, it's great for the interim, for a short term, but then you go do the J juice and you fix that you repair that weakness as if it never happened. And that's the point of J juice. It brings you back. It's your insurance policy. It brings you back to where you were before. Because insurance, you're not supposed to make money or lose really, anything when something happens. That's the point of insurance. Yeah, you lose a lot when you're paying it, but at least, then you have to go in and calculate the cost benefit analysis to figure out, should I have high deductibles or low deductibles based upon your propensity to create an accident. And if you already are accident prone, then you should have really low deductibles because you don't want to be paying all the time, thousands and thousands of dollars. It's like pay now or pay later type of thing. Okay. So, yes, I'll put you outside, sugar. She was outside earlier. She just hates when I talk on this Facebook Live. So anyways, I might modify this a little bit, but I just want to give you guys just a quick, little diagram of this so you understand how this works. And then also this video really is, John, is for your friends that were having a hard time figuring this out. Okay, but every single symptom in the body is the body trying to heal. You're not giving it what it needs. And people have been applying the wrong therapies and people have applying the therapies, which is bad, and they've been applying the wrong chemistry to the body. And then it's a chain reaction of events. Okay, so yeah, it's like I really do need a big whiteboard to then with the human body to show, yeah, if you take this drug or this therapy or this holistic remedy, not only are you you're going to mitigate the pain and traumatize the initial symptom, but then it's a chain reaction to all the other systems in the body being affected. Okay. And so it is more weaknesses. So every single therapy you guys apply to your body, you are creating more weaknesses in your body that the body has to heal from. So the whole thing with the J juice is not only are you healing from the initial trauma, but then every single trauma every single therapy / trauma you apply to that specific system. And then all the systems that are affected from that system, which means it's everything else. So all the therapies are causing more weaknesses in everybody. So yeah, you came in for one thing and now you're getting a whole host of other issues that you have to deal with now or later. So therapy is any therapy, with anything with therapeutic, anything with therapy is causing more issues. I don't care what kind of therapy. On a weak body that's not doing J juice, it is a domino chain reaction effect. And then your belief system, lifestyles, then reinforce it. That's it. You guys have a great day. Talk to you later.